Good morning to all. Today we are celebrating the Oral Hygiene Awareness Program on occasion of World Oral Health Day by the Department of Pedontology, Dental Faculty of Dental Sciences, Uttar Pradesh University of Medical Sciences, Saifai. At present time, all over world is suffering from the oral problems, dental problems. That's why all over world is celebrating a day to make the public aware and take care of the oral cavity. And on this occasion, the world celebrate the oral World Oral Health Day on 28th March every year. In continuation with this, the time has come that oral cavity or teeth are considered not as a separate entity. And regarding this, Dr. Jeffcott has said, it is time for us not to think of our mouth as somehow disconnected from the rest of our bodies. The same blood flows through them, the same nerves goes to them. That's why we have a healthy body. You need to have a healthy mouth too. There is established fact which shows that so many systemic conditions are linked with the oral health like rheumatoid arthritis, osteoporosis, squamous cell carcinoma, placental inflammation, colon cancer, colitis, chronic kidney disease, cirrhosis, obesity, diabetes, cardiovascular disease, pneumonia, Alzheimer's disease. So many nerve problems are also associated with the oral health. That's why if anyone want to be healthy, if the systemic organ be healthy, your oral cavity, your oral health should also be healthy. So for this, all one want his teeth healthy for lifetime. The one question arises for everyone, are you want your teeth for lifetime? And to understand this, you should know, yes, you should understand the fact that teeth forms once in a lifetime. And most important thing is dental tissue does not regenerate. That means it does not heal. Dental disease does not heal. And that's why prevention is the only treatment. In medical field, we usually say that prevention is better than treatment because the other tissue heals itself and ultimately become in the natural way. But in dentistry, the tooth does not heal itself. That's why we have to prevent the dental diseases, and that's why the prevention is only treatment. Then question is prevention to what? From what? So the prevention is always done by the etiological factor, primary etiological factor, and the dental disease and periodontal disease, yeah, even oral disease caused by the primarily dental plaque, which causes both oral as well as systemic effect. So its control is must if you want to control the dental disease, or directly or indirectly we can say that if you want your body to be healthy for longer time. So the plaque control is the one most important thing. By controlling this we can control the dental disease, yeah, oral disease. This can be done by two ways. There are two mechanisms. First, mechanical control and chemical control. In case of the chemical control, different type of drugs, chemicals are used to prevent the dental plaque, but it causes so many side effects. That's why the main emphasis is given on the mechanical control. Statistical data show that the people suffering from periodontitis are about 95%, and the people using the toothbrush are more than 50%. Nowadays, around 95% people uses brush. But the interesting thing is the people visiting a dentist for checkup covers only 2%, which is a very less people who visit the dental surgeon for his tooth dental checkup. So for control of the plaque by mechanical way, we use toothbrush. So there is a proper design of toothbrush having the handle, shank, head, bristles. The bristles is the main part which remove the dental plaque by scrubbing. So if we use the brush in proper way, we can remove the dental plaque. And the technique is known as tooth brushing technique. So there are so many brushing techniques like circular technique, roll technique, vibratory technique, horizontal technique, circular technique, vertical technique. All these depends on the either the placement of brush, where it is placed, or the movement of brush, roll, vibratory, horizontal, all these things. And most commonly brushing technique is the horizontal technique, because one from one person to another person the technique transfer by observing the brushing. The most common brushing technique which uses the public use is a horizontal technique. But what happened in this technique, one thing we should also know that brush cleans the only those site where it come in contact with the tooth surface. If the brush does not come in contact, it will not remove the dental plaque. In this technique, horizontal brushing technique, we can see that the brush cannot reach at this triangular space in between two teeth. We can appreciate here. That's why it does not remove the plaque from this side. That's why normally we observe that the teeth become dirty in only interdental in between the tooth, the first side. Second side where the brush not reaches when we put the brush perpendicular to the tooth surface is the around the gums. We can appreciate here there is a space between the gum and tooth, this triangular area. That's why the second side which become dirty is around the gingiva, gums, a gum line. So, and third place where the brush does not reach is the inside the sulcus. In between the tooth and gingiva there is a space which is known as sulcus, and microbe also get accumulated in the sulcus. When we place the brush perpendicular to the tooth, the brush bristles does not enter in the sulcus, which make a favorable site for the microbial accumulation. So the question arises, what is the better technique by which we can remove the maximum amount of plaque? And that's why the recommended tooth brushing technique is the circular technique, or it is also known as Bass technique because it is given by Bass. So what is this technique? How you brush it? In brushing there are two steps. First is the placement of brush and then movement of brush. The first, the placement of the bristle tip, how the bristle should be placed against the tooth. For this there are two steps. In first step we should place the bristles toward the gingiva, gums, so that we can enter inside the sulcus. Then give a tilt, a small tilt, which make around 45-degree angle between the tooth surface and the bristles. It make around 45-degree. By giving this tilt, what happened? The bristles easily enter inside the sulcus, as well as the bristles get arranged around the tooth at the gingival 1/3, and it also enters in the interdental area where in horizontal technique bristles was not coming in contact with the tooth surface. Now you can see that the bristles are arranged around the tooth and in the interdental area, as well as it enters in the sulcus also. So by placing the brush we can access the maximum area where the plaque get deposited. Next step is the movement of the brush. So in normal technique, in brushing horizontal technique, the brush are moved back and forth in a longer space from back side to front side. But in this we have to give the back and forth motion short motions, so that the bristles which are arranged inside the interdental area cannot displace from its place, and this can be achieved by only giving a short back and forth motion, forth and back motion. Thus it rub the tooth surface, rub the circular area and clean the circular, gingival and the interdental area. In case of anterior region where the adaptation of this brush is difficult, we can put the brush in this. The width of the brush will act as a length so that the bristle give a small tilt so that the bristles can enter in the sulcus. We can appreciate here. And give a left-right motion, a small left-right motion, which cleans similarly in posterior region. It cleans the tooth surface. And the same, this procedure is repeated from the posterior to anterior region, outside as well as inside the tooth. Thus we clean the outer and inner surface. Then the next surface is the occlusal surface, where the food material get grinded and chewed. Normally we clean it by giving a long horizontal motion, but it passes the grooves inside the tooth. For this we have to place perpendicular on the tooth surface and again give a small back and forth stroke so that we can enter inside the grooves. By this we can clean or remove the around 80% of the plaque from the tooth surface. That means directly we can reduce the dental diseases, burden of the disease around 80%. In interdental area, in between the two tooth, where the brush is very difficult and not reaches, we can use a floss. This is known as dental floss, which is something like a thread. We put the thread and give a motion so that we can clean the interdental area. So by this way we will reduce the disease burden around 80%. But the 20% of plaque again causes the dental disease, periodontal disease, which cannot be removed by this routine brushing. So for this we have to visit the dental surgeon. The studies say that we have to visit 6 monthly, but I say that at least once a year, annual visit, we have to visit the dental surgeon. Proper examination should be done, and if there is deposit, we have to remove it. If there is disease which will be at initial stage, will be corrected. So if you want your teeth for a longer period, we have to follow these two rules: proper toothbrushing and annual dental visit. Toothbrushing includes 3 steps. Bristles should be toward the gingiva, give a small tilt, and then short back and forth motion at least 15 to 20 times at each places. Move forward and again repeat the same to cover all the inner and outer surface.
Wind the floss around each one of your index fingers. Push through each of your teeth in your mouth. Be sure to freely move the floss upward and downward, even sideways, to remove any food particles or plaque that may be lodged between your teeth or under gums.
This surface where brush does not reach. On the occasion of this World Oral Health Day, which is celebrated on 20th March every year, we arrange the awareness program for the patient. We can appreciate our dean, our faculty member, which are taking actively participate in this program. These are the some glimpses. They are our PGs, which arrange all the things. And these are the patients. There are some medical students also here. We can see that first we should know about the limitations of the brush by the patient, how they brush and what are the limitations. Then explain the things and give a demo where the bristles are reaching and where the bristles are not reaching directly to the patients. All the patients are very curious, interested, observing the things, and then show the brushing technique. Dr. Rahul is a periodontist. There is a child also having some problem. He is also explaining about the care of the oral cavity of even a child having even no tooth, how the oral cavity are maintained plaque free and disease free. So these are the some glimpses. So after this session, we can conclude that successful plaque control demands a long-term commitment from the dental professionals and the patient as a co-therapist, because the brushing is the one most important way of keeping the teeth healthy, oral cavity healthy. So they are also a therapist with the dental professionals, and this is the responsibility of the dental professionals to train the patients and make them a co-therapist. It is only possible when the patient become aware of the potential role of plaque to cause an oral health problem. And the brushing technique, the best toothbrush is the brush one being used properly. The proper tooth brushing is more important than the design of the brush or even the toothpaste. And the regular, at least annual dental checkup is must to maintain the oral health. Thank you so much for patience listening.